let's talk about sleep apnea and some of these symptoms and causes of as a result of it. Now, whether or not you're on TRT, you may unfortunately become a victim of the dreaded sleep apnea. And if you do have sleep apnea and it's undiagnosed, it does not matter how much testosterone you pump into your body, you're going to be tired. You can't out-test this sleep apnea. Now, historically, when we think of sleep apnea, we tend to think of people who are morbidly obese. But that's not honestly the case. It can affect anyone. Hell, even infants can get sleep apnea, so why can't a regular guy like yourself get it? From a statistical standpoint, roughly 2% of children have it. Cumulatively, about 10% of all adults have it, and roughly about 30% of elderly people have sleep apnea. So to think that just because your body weight isn't a quote-unquote a normal parameter removes culpability from getting it, that's false logic. One of the primary symptoms of sleep apnea is the obvious one. Well, it's snoring. And snoring is a result of increased airway resistance, especially during inspiration. And inspiration is when you're breathing in. Now, just because you do or don't snore, but in this context, just because you snore loudly, it doesn't necessarily mean you have sleep apnea. But if you sleep loudly in the context of having comorbidities such as high blood pressure, particularly resistant or treatment refractory hypertension, or obesity, in those contexts, then the likelihood of your snoring being a symptom of sleep apnea, that increases dramatically. Other sleep-related behaviors that could be symptoms of possible underlying obstructive sleep apnea, they also include tossing and turning, restlessness while sleeping, fitful sleeping, things like that nature. And the reason why is it could be a possible indication that your body is trying to reposition itself to a more conducive position for sleeping and or breathing, or those behaviors could be exhibited because your body's experienced a level of agitation while you're sleeping, and that's secondary to decreased oxygenation. Oftentimes, patients don't even know they're experiencing these behaviors. In fact, a lot of times, they only find out when their spouse tells them, hey, you're kicking, you're tossing and turning, you're flipping, you're agitated while you're sleeping. That's when they typically find out that they're experiencing these behaviors. Interestingly enough, another possible symptom of sleep apnea is insomnia. Yes, insomnia, meaning you don't sleep. But particularly in this case, we refer to that as middle insomnia, or is alternatively known as sleep maintenance insomnia. And that's the type of insomnia in where you can get to sleep, but you don't stay asleep. You have repetitive intermittent awakenings, otherwise known as fragmented sleep. And this typically affects females more than it does males. But regardless, if you're having fragmented, interrupted sleep, chances are you may have sleep apnea. Another possible quote-unquote symptom, and I call it a symptom in this context because it could be a direct result or a coexisting factor to sleep apnea, but another possible one is hypertension. So if hypertension is secondary to the obstructive sleep apnea, then typically, treating, correcting the underlying cause of OSA tends to mitigate and or improve the hypertension. As a matter of fact, statistically speaking, 50% of patients with sleep apnea also have hypertension. And furthermore, the blood pressure readings tend to be much higher in the first half of the day, particularly the first few hours of wakening. So let's say you've been checking your blood pressure and you've got some concern that you may be developing high blood pressure. It would behoove you to monitor your blood pressure, ideally at the same time of day, every day, at least twice a day. That being said, the reason why is because if your blood pressure readings are higher on the front end of the day, but then they tend to improve as the day goes on, there's a chance that possibly it could be secondary to OSA that you're unaware of. And the last symptom I want to cover today is one that pertains to many TRT patients. So I'm talking about increases in red blood cell count and or hematocrit. But before I delve deeper, let's talk about the function of red blood cells. So our red blood cells act like vehicles and they transport oxygen throughout our body. If you have OSA, you're going to experience intermittent episodes of hypoxia. And hypoxia essentially means decreased oxygenation throughout the body, to put that quite easily. Now, these episodes of hypoxia, they stimulate the production of erythropoietin from the kidneys. And EPO is responsible for stimulating the production of red blood cells. Now, that's a compensatory response. Since oxygen levels are going down intermittently, your body is producing more red blood cells in an effort to capture any available oxygen that it can. Other conditions that also increase the RBC count also include COPD, high altitude, cyanotic heart disease. Having a kidney transplant could do it. Various kidney diseases could do it. Obviously, sleep apnea could do it. Carbon monoxide poisoning can do it. The list goes on. Heck, even smoking can increase your RBC count. And other symptoms of sleep apnea that we didn't fully discuss today include TMJ, teeth grinding, headaches, especially in the morning, dry oral passageways, nasal passageways, brain fog, night sweats, excessive daytime sleepiness, another thing we call fatigue masking. In other words, you're on excessive amounts of caffeine to offset the fact that you're tired. Brain fog, if I haven't mentioned it already. And sometimes people actually get misdiagnosed for ADHD, ADD, and get put on stimulants when in fact the underlying cause is that they have sleep apnea, which is interfering with their cognition and making them excessively tired.